event, and so last time we had a good turnout as well. This is awesome too. I think there's like a front and center open area for all the latecomers to sit in the front and be noticed by everyone. But I just wanted to take a quick poll of who we have here, what ages we're working with. Last time we didn't have a PowerPoint. It's easier to look at, but then I'm going to have to stand up and move around. But I just want to let you guys know that's why I'm getting up and everything. But so for our girls here, who is 8 years old? Who is 9 years old? Who is 10? Who's 11? 12? Letting out 13? And 14? Okay. Anybody who's 14 apparently knows everything about it. Which would make sense as we go through this. But okay, so did we do introductions? Kind of, sort of. We can do it again. I just again that I'm Dr. Christina Naldo. I've worked here for 2-ish years, and so I do an abbreviated version of this every time we have our physical exam. I usually start around 8 or 9 as well. So if you come and see me for your physical exam, which hopefully you guys do, or one of the other awesome pediatricians here, you will be pros at this, and I will say things and you'll be like, oh no, Dr. Arnold, I remember already from your talk. You don't have to do it, and then it will make the visit significantly shorter. Okay, so let's get started. So I'm going to stand down here. Yeah, go ahead. So for my side, it's puberty from girl to woman in 5 easy steps, because everyone likes easy steps. So this is my short disclaimer. There aren't a lot of pictures. There's just one picture of your body. But it is a cartoon, so it's not that graphic, but I just wanted to at least put that out there. I'm here to answer all of your questions and have no judgment whatsoever, okay, honey? So, puberty. It's a natural part of everyone's lives, but it happens at slightly different rates and different times, different for each people, okay? Your body makes hormones. They make estrogen, testosterone, okay? And it starts for boys and girls. That's pretty much in the same time, from 9 to 14. So that's why I asked around who's 8, who's 9. So most of you guys are 10, you might know about this, okay? This is just a small, I apologize when I put the PowerPoint together. Apparently I'm not good at image sizing, but basically it shows that for boys testosterone goes up, and then for girls the estradiol or estrogen goes up, okay? For those 5 easy stages that I pointed out, when you come and see me and I'm doing a physical exam, there's something that I learned in medical school called Tanner stages. It goes 1, 2, 3, 4, 5. And that, for your physical exam, helps you decide how far you guys are going on through puberty, okay? So sometimes when you're younger and you see the pediatrician, you're wearing your gown and you're little, and as you get older you get a little uncomfortable, where like maybe you're not being able to wear clothes underneath, you're just wearing your underwear and this gown. The reason why I have you take off your clothes and such as that is because I need to see where you're going along, okay? And your parents are always in the room, and it's not, it's not abnormal for us to do that. So I want to let you know that this is why we have you undressed for your physical exam. This Tanner staging helps me see how your puberty is going, okay? Oops, I stand right there. So, changes during puberty. Before puberty, this is the little girl, and then the big girl after puberty, okay? So, like a 2nd grader and like a 6th grader or 7th grader, okay? So, changes, you've got armpit hair, you've got enlarging breasts, your hips get wider, and pubic hair as well. And then I'll add on to that leg hair, and also with the armpit hair, there's changes in sweat and also then body odor, okay? All things that we're going to talk about, all things that are completely normal. So, this is why, for Tanner staging, it involves looking at how your breasts are growing and how your pubic hair grows as well. So that's why we have to undress you for your physical exam. Okay, this is all normal stuff. So, weird things that happen. You'll see that the boys in your class get deeper voices, or they don't deepen entirely and they squeak and then it deepens again. So, their voices get funny. Some girls' voices can change as well. We check your vision annually as well, because sometimes your eyes can... eye vision changes can get worse, meaning that you get nearsighted, so you can't see the chalkboard or the PowerPoints from far away, okay? You can get sprains and injuries as well because you're going through your growth spurts. So your bones grow really fast, but your muscles and tendons are catching up. So sometimes you might roll your ankle, get aches and pains, get back pain, ankle pain, knee pain, all completely normal. So this is kind of before puberty, an 8-year-old and 13-year-old during puberty. So you're getting ready in the morning, you're putting on your clothes. Maybe when you were before puberty, you could pick a different shirt so your outfit looks different, but you might wear the same socks, same pants. But now, after puberty, you have to change all of your clothes because they smell. and you're sweating. You have to wash your body and hair. Maybe you can go 2-3 days before puberty without having to take a bath, but when you're in puberty, you have to take a bath every single day, or shower every day, okay? Before puberty, you had hair only on your head, and now you're noticing it's on your armpits, you might have some on your legs, you have some hair in your panties area down there, okay? Totally normal. Not so sure about chest and back, you might have a little bit there too. And then friends, so this is kind of the emotional changes of puberty, okay? Initially, you're hanging out with your good friends, you're playing your games, you're watching your movies, but then everyone's talking about dating and boys and the clothes they're wearing, and it gets a little more complicated, okay? I love Pigpen from, I don't know if any of you know what Peanuts is, but I guess they redid the movie, but that's an old comic where he was really stinky. So this is true. If you can smell yourself, everyone else is smelling you as well, okay? This is because it's part of puberty. Hold on. So skin and scalp become oily. Things like acne will occur. I have a slide on that as well. You have new hair going in different places. You seem to sweat for no reason. So it's not just when you're playing in the playground or anything like that. It might just be when you come home from school or even when you wake up in the morning. You might have that. And new odors around you've never noticed before. So you might notice the boys in your class already. You have to bathe every day, please, and wear clean clothes every day. That is everything. So socks, shoes, shirt, pants, please. And then deodorants and antiperspirants. So the antiperspirant is the one that helps you with sweat control, and the deodorant is just the scent. You can get them together or separate, and that will help also with your armpit stains. Okay. So menstrual hygiene, Dr. Trankin is going to talk more about periods, okay? But there is one thing, sometimes girls will notice that they have when you're on your period, there's a smell that you can notice on your own self. But just to put it out there that other people don't smell that, okay? So don't be shy about it, don't be nervous about it. Just shower every day as normal. We're going to go through some of these products. Some of them are scented, okay, to help with that smell, but you don't have to use those. A lot of times, for me personally, I'm concerned about sensitive skin, and I don't want you to be using any products that have a strong fragrance, things like that. You could get irritated, you could react to them, okay, and you don't need to have those things, right? Body hair. So your teenage hormones, your testosterone, actually, the androgens are what's causing the body hair to grow. Just to be aware, so you can do different things for your leg hair, armpit hair. You can shave, you can wax, you can bleach. There's things called Nair, which actually takes them away. It fizzes and it's kind of scary. But you'll talk over with your mom, whichever one you guys want to use. But you don't have to do anything, okay? Everybody has it. Oh, I just talked about that. Acne, so most of you have acne at some point. A lot of times your face starts to get oily. You might notice little red bumps. It's not a rash, it's most likely acne. There's two different kinds. There's ones that are red and they hurt, and there's one that are called whiteheads or blackheads, just little white or black dots, okay? That's normal with puberty. And you just want to either wash your face with a medicated wash, or you can come to me and get a topical medication. You can also use by mouth medications, so come to us if it's not working. I'm actually realizing that I think I skipped the most key slide. I realized. Looking back. There we go. Talking through all these things, but I didn't get to that one. Okay. So, this mnemonic that I learned in residency for puberty, because we said, right, it's between 8 or 9 to 14. Breasts begin to grow first, then you get your pubic hair, you go through your growth spurt, and then you get your first period. So, the mnemonic I remembered and I learned was boobs, and then pubes or pubic hair, okay? Then you grow, you get your growth spurt, and then you have your tubes, which is your fallopian tubes. We'll talk more about that for your period. But it rhymes, so first your boobs, then your pubes, then your tubes, okay? So when you first see me, I'm gonna ask you when you're like 9-ish, and you took your shirt off and you have your gown in the exam room, I'm going to say, have you started wearing a sports bra? Are you wearing a sports bra when you do soccer practice? Do you wear a shirt with a cami or the shelf because you notice that there's like some lumps on your chest? That shows me that you're starting puberty. That being said, last time we talked, I had a lot of girls and moms come up and say, well, I'm not wearing a sports bra, but I noticed that I have hair in my panties area. This isn't an exact science, but this helps me every year when we're talking about your puberty and your growth. Let me know where we're going and how far along we're going, and in general what the order is, so you can be prepared. So if you just started wearing a bra, we don't have to talk about periods yet. We can introduce it, but we don't have to get serious about it. If you're already starting to have pubic hair, it's going to be within the next year or so, and I want to talk about it, okay? I apologize, I didn't realize I skipped just to all this. Okay, so we did acne. Oral health as well, so you still have to brush your teeth as well. School gets more stressful as you go into middle school, you're going through puberty, you have other things you want to deal with, you have friends. Don't forget to brush your teeth. Most common infection in pediatrics is actually cavities. I know that has nothing to do with puberty, but we're talking about body odor. Your breath might also smell, so please brush your teeth. Sleep hygiene. So the thing that happens with puberty is that not only is your body changing a lot, but your demands at school are getting higher, okay? And a lot of times, stressors at home, stressors at school, stressors with friends, we might not sleep as well as we're going through puberty and we're becoming a teenager, okay? So a lot of times they stay up late, and teenagers have to stay up late because they have all their homework, they have to get up early for practices, sports, things like that. It can cause stress levels to go up, and that can also affect your body hormones. It can make your acne worse, make your appetite change. So teenagers really need between 8 to 9 hours of sleep at night. So I don't know how much sleep you guys are getting, but most of the time we have bad sleep hygiene habits. So you might go to bed at 9 or 10, but you're really not conked out till midnight. And a lot of times it's because there's a TV in the room, you're on your iPhone, you're going through Facebook and things like that. So what I would really want you guys to start practicing now is having good sleep hygiene. So the bright lights on your TV screen and in your cell phone, what it does is it confuses your body, your circadian rhythm, the chemicals in your brain that it's still daytime and it's not night. So you're really supposed to turn off your electronics at least 30 minutes before you start getting ready for bed. So if you're going to say goodnight to mom, you're turning off your phone and you're putting on the tape, okay? Because otherwise you're not going to get your full hours of sleep. You need to be in a dark, quiet room, and you need, again, 8 to 9 hours of sleep at night. The other big important thing is body image. So as your bodies are changing, like we said in the first slide, everybody's body is changing at different rates. So some girls in your class might be wearing bras and talking about their periods and you haven't done any of that. And that's fine and it's normal. I don't want you to ever base how you're doing in your body compared to what other people are. And that's a life lesson for ever, okay, as women. It's hard to be a girl growing up, it's hard to be a woman growing up, okay? The key is to be happy with who you are and to see your physician regularly, and so we know and we're keeping track with your growth and your development, and we're able to also help you know that everything is going according to plan, okay? If you feel like there's maybe something wrong, let your parents know or bring it to us. Any questions from me? Kind of want to do questions at the end, actually, so if that's all right, we're going to hand it over to... Yeah, Dr. Chen.
All right, hi everyone, I'm Dr. Diana Trantamrashi, the OBGYN, so I will only talk about the girl side because I do not know anything about boys. I'm going to be focusing mainly on the menstrual cycle, and we'll talk about different things, and also, you know, after you have the menstrual cycle, what should you come and see an OBGYN for when, you know, you have more questions, and what things during puberty that you should be concerned with, okay? So I'm actually new to Caduceus. I've actually only been here for a little less than a year, so I love California. I think that these events are so wonderful. So one thing I do ask everybody is we're going to do this in the future again. So if you know anybody that has, you know, a younger girl that has any questions or anything, please spread the word. I mean, we really love doing stuff like this to help, you know, communicate with the whole community and give, you know, good information and positive images to, you know, women and young girls, okay? All right, so the menstrual cycle, right? I'm actually gonna step down and feel so tall. So yes, the menstrual cycle, you always hear about your period, menarche, menstrual cycle, the flow. There's so many different words for it, but it happens at different times for young girls, and when it happens, a lot of times you can't answer all those questions. So you kind of remember, but you know, you had like that education in your school when you were in, you know, 4th, 5th, 6th grade. That was a long time ago, and there's a lot of information out there, and it can be really, really confusing. And now there's so much more information, and you want to make sure that, young girls are getting the right information because they can go online now and they're seeing all this stuff. And sometimes they're like, oh, well, this happened to my friend. Why is it not happening to me now? And to understand that there's a wide range. So I'm going to talk about the normals and I'm going to talk about the outliers because that can also happen. And then when should you be concerned? Okay. All right. So menarche, that is your first period. Okay. So she talked about breast development. So between the age of 8 and 14, okay, usually, let's just say 8. After 2 years after that, usually that's when most periods start, okay? But there's a big range, just like with 2 to 3 years after breast development. So when you see the changes, that's something that's going to come. So it's a good time to start talking to your daughters about it. If their body is starting to change, to say, in the future, you might have something called a period or a flow of blood that comes out, and that is perfectly normal. Because a lot of times what happens is, it happens and they don't know anything and they get scared. And that's a completely normal reaction because blood can be very scary because that's when you see blood when you get hurt, you scrape or something like that, that's all they know. So starting that conversation when you see that change is a good amount of time. And it gives you a lot of time to slowly broach it. And then comes your puberty, right? All right, so the average age is 12.4 in the United States, okay? That's a big range. 90% is by the age of 13.8. That means that they can start as soon as 8 years old, which is an outlier, but I have seen it as early. But usually an average is 12, but I've seen as far as 15, 16 years old as well. So there's always outliers for different, and it also matters when genetic ones. So when you started your period, usually it correlates to your own daughter, okay? So, the other thing is, if a patient has come in and she's like, I haven't had my period at 14, usually I say, wait, give it a little time. But usually around the age of 15, I do have patients coming in, and that's when I start doing things work. So, not that's not normal, it's just you want to have preventative, okay? So usually if by the age of 15, you have not started your period, I would recommend coming either seeing Dr. Arnaldo or me, okay, and we can definitely discuss and see what is going on, okay? So, apart from that, most girls, when they have their first period, their subsequent periods are not normal. And what I mean by not normal, so, a period is when you have a flow, usually 2 to 7 days or so, and you have it monthly, right? That's how you understand periods are every month. Well, for a young girl, that's not established right away. And the reason why is because that message from the ovaries to the brain, okay, is not mature yet because they're going through puberty. So we know that. So sometimes it takes as long as 20 cycles for it to be completely regular. So they might have a period every 2 months, every 3 months, it might last 2 days, it might last 5 days. So it's not something that's completely regular right away. And some of us kind of remember back then when we first had a period, I remember having my first period and then not having a period for a few months and then having it every 2 or 3 months. It was completely irregular. And then a year later, I kind of noticed the pattern, which is nice because having a pattern, you know when to have your pads, your tampons, etc. But preparing your daughter for that is important and having that understanding that that first period, that next one might not be regular, and that is completely normal, and everybody is different. Somebody might just have their period, they start having it every month, some might not have it right away at that time, and that's okay. Her body is still maturing, and that's a normal process, okay? So, what is a menstrual cycle, okay? So, a cycle is what it is. It's kind of a full circle kind of thing. So the first day of your period, the first day that you see spotting, the first day that you see bleeding is day 1. Okay, that's important because I'm going to have some images. We're going to talk about that. And on average, okay, you always hear about the 28-day cycle. How often do I see the 28-day cycle? Not often. Okay, not often. This number is an average. It's great if you have a 28 cycle, good for you. But most patients will have that range. 21 to 45 days. I wish I had the 45 days, to be honest with you. So, but that's something we need to tell young girls because they hear about, oh, it's supposed to be every month, on the day. And you know what? It doesn't usually happen. You know, you're going to have a day off and, you know, you might have a 21-day cycle this month, but next month is a 24-day cycle. It's still monthly. That is still normal. And that's for everyone, not just young girls, that's for everyone. And as you get older, usually it gets more regular. And that's what's nice, because it's nice to know I'm going to have my period on the 11th every month, right? Because you're ready with your pads and tampons and everything. But at first, it's okay to have that range, and that is normal, okay? So this, we're going to talk about the uterus, okay? So first, what is the uterus? Okay, the uterus is the female organ in your pelvic area, so right deep in the husband. Okay, and the uterus, okay, is the area where the lining on the inside gets thick, okay? And when there's no hypothetical baby, you have your period. And why does that happen? Because you have hormonal changes. So you go through puberty, your ovaries start secreting all the hormones, and your body changes, your brain and everything, talk about that maturization kind of thing, occurs, and your uterus starts producing this endometrial lining. Okay, which is, oh, you can't see on there. Okay, this doesn't work. Okay, so I'm just going to point at it. So pretty much you have this lining on the inside, okay? So this lining in the inside is kind of a cushion for pregnancy. But there's no pregnancy, so what happens? You get your period every month, okay? So it's very, very thick. And what happens is the period comes out, okay? And that lining gets thin again. Okay, so pretty much every month, what happens is you ovulate. What is this word ovulation? Well, ovulation is when the ovary releases an egg. You always hear about this eggs, ovulation, everything. It releases an egg, and it goes down the tubes, okay? And it goes down the tubes, and unless there's a hypothetical baby, you get your period. And everything comes out at once, okay? So on day one, you have that spotting or that bleeding, okay? And as your period goes on, from the range from 2 to 7 days, you're going to have some bleeding. Some days will be heavier than others. Okay, so you might bleed and it might look like clots. That's okay. That's also normal. Everybody bleeds differently. Sometimes you'll have spotting for a few days. Sometimes you'll have a heavy bleed and it'll be really a lot on your pad or tampon. Okay, and that's okay. And usually it's a range. Sometimes you have 2 to 3 days of heavy and then you have spotting for a couple of days. Or it switches. But that is normal, all right? So a lot of times during your period, okay, you're shedding this lining that looks like blood, and it is bloody, and that is normal, okay? You're gonna have cramping, okay? You always hear about that, well, they're like, oh, I'm having so much pain, I'm cramping. That is normal. However, okay, if you use over-the-counter medication, Advil, Tylenol, Midol, Aleve, any of those, and it is not enough for you, you should come and see us, either Dr. Ronaldo or me, because there's things we can do to help with that. Because you are growing, you are learning at school, you're playing sports, you have a lot of things to do. And if you're going to have your period every month and you're not feeling well, we can help you with that. And that's very, very important that you know that, okay? If you're going to, every month you have to go to like the nurse's station or something like that. We can do something to kind of, and also let that prepare before your period. If you know you have cramping before your period, you have an event, we can also help you with that, okay? And the sooner you get help, the better it will be, and we can help control periods if they get too heavy. There's things we can do as well. And during this time, a lot of things can also help apart from class. One, make sure you stay well hydrated, good diet, okay? Exercise is actually really, really good. It actually really, really helps with, the pelvic pain that you get from menstrual, like the cramps and everything. Over-the-counter medication is wonderful. I personally recommend more anti-inflammatory kind of medication, so like Advil, Aleve, Midol is great. Over other medication. And it's cheap, it's usually something you have in your cupboard already, so that is very helpful as well. And also, I love heating pads. I think they're so great. especially, after anything, when you sprain a muscle, anything like that. Heating pad, little things like that can also help. But despite all that, if it is not enough, come see us. We are here to help you and also ease, the transition for, all the young women here, okay? So, I think I kind of want to, okay, so just as more to reiterate. So most periods are 3 to 5 days for most women, okay? But the normal range is still 2 to 7. Some women just spot for 2 days. Some women bleed for 7 days, okay? That's the normal. However, a lot of times some women might go a little bit longer. Come see us because you don't want to bleed so much as well, and you're feeling tired because you're losing all that iron. You become anemic. So it's better to catch that early on and come in, and you don't have to backpedal, But remembering that periods are not all the same. I think that's the big message I'm bringing out right now. Because a lot of times everybody's like, well, she only bleeds for 3 to 5 days and that's it. Why am I not like that? Everybody's different. Everybody's different. Okay? And understanding that flow is different. Everybody might think I'm bleeding a lot, but really, in reality, that's not a lot, but you're just unaware. Nobody really talks about this. Okay? But those are the type of questions you can ask your mom. Okay? You can ask us as well. And there's no weird question. I guess that's the best thing because you should know. Your body is changing. This is a big deal. Okay? So the last sentence is for all women overall. So if you've had an established period, meaning your periods are regular, and then you don't have periods for 90 days, okay? Come in and get checked. Does that make sense? So this is for younger girls. So if there's something else going on, if they start having weight gain, a lot of pelvic pain, acne, things like that, there might be something else that's going on. So I would always kind of bring that in as well. Obviously for older women, if you skip your periods, please just come and see me right away. Okay? All right. So, yeah. So when you have your period, what do you do? Do you know? What do you do? Pads versus tampons, right? So I do have some props here, but let's talk about them real quick. So pads or there's different ones. There's small ones and big ones. There's regular size, there's extra long, overnight. There's so many options out there. You find whatever helps, okay? But, so they sometimes will come in discrete packs like this, okay? These are more like panty liners, but they look the same. I'm going to show you guys how it looks like. So, and there's so many brands, Always, Kotex, Costco brand, So, a pad looks like this, okay? And what you do is it has usually an adhesive in the back. Sometimes it has something called wings, okay? And what this is for is you put it on your underwear, okay? And if you have bleeding, it catches the blood in here. Okay, and depending how heavy your flow is, you might need a different size pad. So if your flow is very light, you might have a smaller pad. If you have a heavier flow, also you gauge how long you have to keep the pad on. So if you're on a long car ride, you might need a bigger pad. But the thing is, it's all about, we talked about hygiene, right? So you shouldn't keep the pad on all day. Okay, so next slide is that. So tampons and pads there. So, this is my next slide. So, with pads, usually the same thing. I think she mentioned it. At least every 6 hours, I would change. Okay. Overnight, there's certain pads that you have overnight which are fine, and that's if because you're laying down, you're not moving, you're not sweating, or anything like that. With tampons, I usually say change it when you use the bathroom. It's the easiest time. Okay, and every 3 to 4 hours. I'm going to show you guys how a tampon looks like, and I'm going to show you, or explain to you, sorry, I'm going to show you, explain how a tampon can be used. All right, so Tampax, which is one of the oldest, I remember using this when I was a teenager as well. So they come in different sizes, and they come in different applicators. Okay, what I mean by applicators is where the tampon is held. This is a paper applicator, but they have these nice gliding plastic ones now that glide really well. There's ones that have no applicators, okay? So, a tampon is something that you put inside the vagina, okay? And it holds blood inside the vagina, okay? So this has a paper applicator, all right? And the paper applicator, the reason why it's an applicator is because when you push it in, it pushes the tampon inside, okay? And it's small. So this is actually one of the bigger ones because it's tampons, paper applicator. But this is how it looks like. And there's some that are like half the size of this, so very, very small. And what's great about these is it looks big, but it gets really big. It can get really big to absorb the blood. So I will give this to somebody, and you put it in the water, and you can see how big it gets, because it absorbs, and that's what it's for. It's to absorb the blood, right? And the reason why you should remove everything is because it gets saturated, and you need to remove it and put a new one in. What's great about tampons? Why would you want to use a tampon over a pad? It's kind of weird to put it in, right? Well, sometimes you might go swimming, right? If you go swimming, you can't really wear a pad or anything like that. So this is kind of nice to have, okay? This is not dangerous to put in, okay? If you need help, please ask your moms. If you need more help, please come and see us, okay? And they're small, okay? This is, like I said, a larger one than usual, but this is the standard one you have here. And they're safe to use, okay? A lot of times back then they worried about toxic shock syndrome. I don't know if you guys heard about that before. They were the super absorbent ones. We don't use those anymore. And you realize that was not good. Because there was like this new novel thing. You just use something that you don't have to take out, right? It was not a good idea. So, but now they don't do the super absorbent material and all that. So that's why removing them often is important. And because they overflow, okay? But tampons is another option you can have. If you go into the internet, which I know everybody does, there's other options out there. There's something called cups that can also be used. I don't see that too often. Girls don't ask about that too often, but if you do, that's something you might find. What I'm saying is there's other options out there apart from tampons, apart from pads, okay? All right. So, that is pads and tampons. So, beyond adolescence, after your period and everything, why is it important to monitor your health? Okay, so first, as you get older, you do from the pediatrician, who does a wonderful job, make sure you guys are all nice and healthy. You come and see me and we talk more about women's health. So I continue monitoring your period until a long, long, long time, okay? And we want to make sure that you're healthy throughout that time. So I pap smear starting at the age of 21, okay? You want to make sure you're checking your breasts still. It's very important. So when your breasts get developed until you're older, you do self-breast exams, and then you get mammograms, and you get checked, okay? And then you do your pap smears, you do your pelvic, anything that's abnormal down there you need to get checked, or just make sure preventative-wise you're taken care of. So it is really important to continue the process that, your parents are taking you to a pediatrician all the time to be seen so that you are healthy. And you should continue that when you get older, okay? Because you want to make sure you're doing well and you're healthy and everything, that you're pretty much checking your health list off. So that is really, really important to continue that as well. Obviously, as you get older, there's your bone scans by the time you're 50, and your colonoscopy. There's a lot preventive out there as well. So I know we concentrate a lot on puberty about kids and about the changes, but I just want to remind also, because I know you're here for your kids, but we're also here for you moms to take care of yourself. Because you concentrate sometimes so much on your kids, and I know I have 2 kids, and you forget about your own health, and it's really, really important that you do come in and get checked out, because preventative-wise, it is so important. You catch that early, you're a little anemic, take care of that so you're not tired, so you spend more time with your kids, and you might need just a little help. Maybe your cholesterol is a little high. We're like, you know what, just need to change your diet, eat better, and that reflects on your kids because they see that you're going to see the doctor and you're taking care of your health, and that pattern continues, so they're healthy throughout their life as well, and that reiterates in future generations as well. All right, so that's the end of my talk. Do we have any questions or anything? Oh, that's the bone scan. Sorry, Dex says the bone scan. So it's the dual X-ray. Okay. The E doesn't say it's the do X-ray. Yes. So the first question is, what's DEXA? That's a bone scan. The second question is, what's spotting? Okay. So spotting is a lot of times when you bleed. You know how you bleed just a little bit and it looks like little spots? So sometimes during your period, instead of having, because you always hear like it's a huge flow, that's not true. Some women just spot. They just have a little bit of vaginal bleeding spotting. So very, very little, and that's what spotting is. Any other questions about women changes? And yes.
So this, you know how they still have the tampons that are super absorbent plus. So that is not made of the same material that the previous super plus were made of, or it's still the same material?
The question was, they're asking about tampons, the super absorbent plus material, is it the same thing? So it varies, is the answer. And the thing about the super plus, it used to be all over the shelves. And because of toxic shock syndrome, and we've heard about this, a lot of companies have pulled out from that. And they are still available, but the caveat is to not leave it in for a long time. Because what happens is people forget. They put a tampon in and they do their activity and they're like, did I remove it? And that's the reason why I say just remember to always have the string there, go to the bathroom, change it for a new one. Because what you worry is about, after a while, it can tear into the skin, and that's how the bacteria can get in. And that's how toxic shock usually happens. And you don't know when it happens. You just start getting like flu-like symptoms, flushing, things like that. So the main thing that you can do is to remove it and change it every 3 to 4 hours. That kind of gives you a better grasp. So when you go, you kind of go pee that often. So I usually tell my patients, just take it off and you use the bathroom and put a new one in. Okay. Oh, sorry. Then you had a question. Any question for Dr. Nalda? I know she had more peds questions as well.
Yeah.
About changes or anything like that. Yeah, go ahead.
Tampons, like when I was younger, I thought it was going to be lost, so I didn't know if you wanted to.
Sure. So the question was, one of the moms said that she was scared that a tampon might get lost if you place it inside. So let's talk a little bit about the anatomy of the vagina. First of all, it's not ever ending. It's a pouch.
Yes.
Okay. And tampons, it's not a pouch that's open. So your vaginal wall is pretty kind of thick, so it kind of wraps around the tampon. And tampons have a string. So you see this string right here? Okay. So when you put it inside the string, actually you see the string on the outside. And it's a tiny little string. Okay. So if the string is there for you to remove it, you literally just pull it out and the string is there. Okay? Have tampons gotten lost? Yes. Okay? But you can't remove it because, like I said, the vagina is a pouch. Okay? So you can put your hands inside and you can just grab it and you pull it out. That's it. If you need help, once again, we are here for you. Okay? And it's not unusual. I have removed tampons before to help because sometimes this is new to you. And something that's new is scary, and that's okay. And you can always ask your mom. She has so many years. Your mom, your grandma, they have so many years of experience. Okay? If you need somebody else, we're here for you as well. But your moms know so much. They are so wise. They're all experts in this. Okay?
So the question was, what kind of deodorant do you recommend for young girls? I would say whatever you will consistently use is probably the best answer. Okay, because my recommendation is try. They can have the travel size ones, so try them because a lot of times the fragrance that they use you can sometimes react to. So, like for example, Suave would give me a rash. I can't use Suave, but I can use Dove and things like that. So I would try a gentle one. We don't get paid for this, by the way, so I'm not getting no stock in Dove. But I love natural things like that. So sprays and roll-ons or the deodorant powder, the sticks, like tampons. There's such a variety. But you buy the travel size and see what she reacts to or what she can use consistently. And the most important is that she's going to use it consistently. There's no benefit to either one as long as you use it appropriately. So yeah, there's not one that's necessarily better than the other. But making sure that if you're looking for an antiperspirant, it says antiperspirant because they have ones that are just covering the smell, just the deodorant, and then you want to see that it has the perspirant as well to help with the sweat. Yeah, of course.
We talked about body odor and everything like that. I'm big into natural and non-perfume, no parabens and everything like that. So I do agree a lot with the Dove or Ivory soap, and that's also to clean yourself. I know you want to smell good and everything like that, but a lot of times there's certain areas, okay, like in other regions, it's very sensitive to